Hello learners, welcome to lecture 58. In our previous lecture, we explored the concept of advocacy for reproductive and child health rights, focusing on how communities, civil society, and individuals raise their voices for health justice. Today, we shift specifically to policy advocacy, an approach that seeks to influence the laws, regulations, and policy frameworks that govern RCH services. Policy advocacy is not about shaping systems rather than addressing individual cases. Policy advocacy is about shaping systems rather than addressing individual cases. It involves evidence, negotiation, and strategic communication to bring reproductive and child health higher on political agenda and ensure equitable policies. Policy advocacy refers to systematic efforts to influence policymakers and institutions to change laws, regulations, or budgets in ways that benefit public health. Unlike service level interventions, policy advocacy seeks long term systemic change. In RCH, this could mean pushing for stronger maternal health policies, improved child nutrition schemes, or legal reforms around reproductive rights. To make this real, advocates turn evidence into clear asks with timelines and costs and present them at key moments like budget and review meetings. They build coalitions of clinicians, women's groups, youth leaders, and NGOs so many trusted voices repeat the same messages. Simple policy briefs, one strong chart, and a short reply story help decision makers act quickly. Progress is tracked on a small dashboards with equity checks for rural, tribal, and low income groups. Regular updates keep officials accountable and communities engaged, turning advocacy into lasting system change. Policy advocacy is essential in RCH because many barriers to health are structural, such as discriminatory laws, underfunded programs, or rigid policies. Advocacy mobilizes political will, ensuring that reproductive and child health is prioritized in national agendas. By influencing policies, advocacy also ensures sustainability, as programs supported by law or government funding have longer lasting impacts. It translates evidence into clear asks that lawmakers can act on, like increasing budgets, updating guidelines, or removing harmful rules. Strong coalitions help the same messages reach the parliament, the ministries, and the media. Simple policy briefs, one strong chart, and real stories make the case easy to understand and hard to ignore. Once policies change, advocates track implementation and equity, who benefits and who is still left out, and push or fixes. This cycle turns research into durable systems that protect mothers, newborns, and children year after year. Policy advocacy differs from community or media advocacy because it has a broader scope and focuses on systemic changes. It directly engages policymakers, ministers, and bureaucrats, requiring both technical knowledge of health issues and political skills to negotiate and persuade. This dual nature makes policy advocacy powerful but also complex. Policy advocacy usually follows a structural process. The first step is to identify the issue and recognizing policy gaps. Next, advocates gather and analyze evidence to support their case. Building coalitions strengthens influence. Engaging decision makers requires direct communication, often through policy briefs or consultations. Finally, monitoring ensures promises are kept and policies are implemented effectively. Addition of practical steps like write a short problem statement and 3 to 5 smart policy asks with estimated costs and legal references. Map stakeholders and power. Then, time outreach to policy windows like budget sessions or program reviews. Package evidence into 1 to 2 page briefs, a slide deck, and a 60-second pitch for quick meetings. Agree in writing on who will do what by when, and track implementation on a simple public dashboard with equity breakdowns. Close the loop with updates and adapt the strategy based on feedback and results. Policy advocacy uses various tools. Policy briefs and fact sheets distill evidence into concise, actionable messages. Stakeholder consultations bring together experts, officials, and communities. Media campaigns can generate public pressure on policymakers. Legislative lobbying involves direct engagement with lawmakers to propose or amend laws. Effective advocacy often combines these tools strategically. Evidence is the foundation of policy advocacy. Data on maternal mortality, child immunization, or malnutrition highlights urgent needs. Cost effectiveness studies appeal to policymakers focused on resource allocation. Case studies of successful programs demonstrate feasibility. Evidence provides legitimacy and credibility, making advocacy harder to dismiss as opinion. Turn this evidence into clear policy asks with timelines, costs, and who is responsible. Always show gaps related to equity by wealth, caste, tribe, gender, and rural urban so leaders see who's being left behind. Pair one strong chart with one short success story to make the case memorable and practical. Use simple dashboards to track progress and share updates, reinforcing that decisions are data driven and deliver real results. Coalitions are central to policy advocacy. By uniting multiple stakeholders, NGOs, academic institutions, professional associations, and community groups, advocacy gains greater strength. Coalitions amplify voices, pool resources, and strengthen legitimacy. For example, maternal health advocacy is more impactful when doctors, women's groups, and media work together. Engaging policymakers requires understanding their priorities and aligning policy messages and advocacy messages with them. For instance, linking child health improvements to national development goal resonates more strongly. Building relationships with policymakers ensures trust and long-term influence. Framing messages strategically, like emphasizing economic benefits, public demand, or human rights, makes advocacy more persuasive. At the national level, policy advocacy influences laws, budgets, and program design. It can push for stronger reproduction rights legislation, increased funding of maternal health, or expansion of national immunization programs. National level advocacy shapes the legal and policy environment in which RCH services are delivered, ensuring systemic impact. To make this real, advocates prepare short policy briefs with clear asks, costs, and timelines and present them during budget sessions or program reviews. They build coalitions, as I previously told you, with clinicians, women groups, youth leaders, and NGOs, so many trusted voices repeat the same messages. They link proposals to national priorities and the Sustainable Development Goals to win broad support. Simple dashboards then track what changed. Laws passed, or funds released, or services improved, disaggregated by state wealth, caste, tribe, gender, and rural urban data. Regular updates keep ministries accountable and show the public that policy advocacy leads to real improvements in RCH. Policy advocacy is not limited to national level. State and local governments play a key role in implementing policies. Advocacy at the level ensures that national programs are adapted to local needs and that accountability mechanisms are in place. For example, ensuring proper functioning of Anganwadi centers often requires state level advocacy. The Janani Suraksha Yojana in India is a case of successful policy advocacy. Civil society and experts highlighted maternal mortality, presenting evidence that cash incentives could improve institutional deliveries. Persistent advocacy influenced government adoption of the scheme, which significantly increased facility based deliveries nationwide. Advocates translated data into simple, clear asks like cash support for pregnant women and community incentives for ASHA to reduce the cost and distance barriers families faced. They used national survey findings and small pilots to show feasibility and value for money, which helped to win political commitment. Once adopted, the scheme was refined through monitoring, streamlining payments, linking with free maternity entitlements, and targeting poorer households. The key lesson is that demand side incentives can raise use, but they work best when paired with respectful, good quality care at facilities. The Right to Education Act illustrates how advocacy links health with broader social determinants. Advocates highlighted the impact of education and child health, leading to legal reforms ensuring free and compulsory education. This indirectly improved child nutrition, immunization uptake, and overall welfare, showing how cross sectoral advocacy benefits RCH. Polio eradication is a landmark in policy advocacy. Global coalitions like WHO, UNICEF, and Rotary, along with national governments, mobilized political will, resources, and public support. High level policies advocacy ensured polio campaigns become national priorities. The result was elimination of polio in most countries including India. Advocates turned evidences into clear asks like free nationwide rounds, strong cold chains, and door to door vaccination, backed by steady funding and political commitment. Simple, repeated messages and trusted champions kept families engaged, while real time monitoring helped find and vaccinate missed children. The big lesson for RCH is that coordinated policy action, community mobilization, and reliable last mile delivery can turn ambitious goals into measurable success. Policy advocacy often faces barriers. Political resistance arises when issues are controversial, such as abortion rights. Bureaucratic inertia slows reforms even when policies exist. Conflicting interests, such as commercial lobbies or cultural opposition, may dilute advocacy efforts. Advocates must anticipate these challenges and strategize accordingly. Overcoming barriers requires smart strategies. Building bipartisan support. Building bipartisan support ensures advocacy is not tied to one political group. Framing issues in terms of economic growth, productivity, or social stability makes them more appealing. Sustained engagement and persistence are critical. Policy change really happens overnight. Policy change rarely happens overnight. Turn evidence into simple, shared asks that leaders across parties can endorse and show how better RCH outcomes boost the economy and social stability. Use clear cost benefit notes and real stories to make the case human and practical. Keep steady contact with policymakers. Hold follow up meetings and track promises on a small public dashboard so that momentum is not lost. Celebrate from wins, then identify and learn the bottlenecks and stay consistent, Persistent plus credible evidence is what turns advocacy into lasting policy change. NGOs play an indispensable role in policy advocacy. They bridge the gap between communities and policymakers, bringing grassroots voices into policy spaces. NGOs also provide evidence from the field, showing what works and what doesn't. Finally, they monitor whether policies are implemented as intended, holding governments accountable. International organizations like WHO, UNFPA, and UNICEF influence RCH policy through agenda setting and funding. They support coalitions that amplify advocacy, provide technical expertise, and mobilize resources. Their involvement strengthens local advocacy by linking it to global frameworks and international communities. Policy advocacy must remain ethical. Advocates should be honest and transparent, avoiding exaggeration or manipulation of data. Community voices must be authentically represented, not tokenized. Advocacy must serve the interests of women, children, and families rather than the agendas of institutions or individuals. Policy change often depends on timing. Policy windows such as elections, new government plans, or health crisis creates opportunities for influence. Effective advocates link their campaigns to these cycles, presenting evidence when policymakers are most receptive. For example, advocacy during the COVID 19 pandemic highlighted the importance of strong maternal and child health systems. Communication is central to policy advocacy. Messages must be clear, concise, especially for busy policymakers. Data visualization in the forms of charts, graphs, infographics makes evidence accessible. Storytelling humanizes issues, showing how policies affect real people. Combining these approaches ensures advocacy messages are persuasive and memorable. Turn your evidence into a one-page brief with 3 to 5 simple asks, one strong chart, and a short real-life story. Use plain language, large fonts, and clear titles so the key point is understood in seconds. Tailor versions for different audiences, ministers, program managers, and communities, and repeat the same core message across slides, short social media, and meetings. And every communication with who will do what and by when. So the messages lead to action. Track which messages get responses and refine them to keep influence growing. Advocacy must be monitored for effectiveness. This involves tracking debates in legislatures, evaluating whether recommendations are adopted, and measuring changes in health outcomes. For example, if advocacy calls for more midwives, progress can be measured by tracking recruitment and maternal health indicators. Monitoring strengthens accountability. Add a simple dashboard. List each recommendation, the responsible agency, budget released, and timelines, plus equity breakdowns like rural, urban, caste, tribe, or wealth. Use routine data, for example, from HMIS or NFHS, and quick spot checks to verify on the ground changes like staff posted, supplies available, or services delivered. Hold regular evidence to action reviews with minutes and you said we did updates. So commitments on public are time bound. When progress stalls, document the barriers and adjust the strategies like new allies, different messages, or focused pilots to keep the advocacy moving. Digital platforms are increasingly important in policy advocacy. Social media campaigns can mobilize public opinion rapidly. Online platforms gather widespread support, pressurizing policymakers. Digital storytelling through videos or blogs personalizes issues. These tools democratize advocacy, making it accessible to younger generation and wider audiences. The Sustainable Development Goals provide a global framework for advocacy, linking campaigns to Sustainable Development Goal 3, that is related to health, or Sustainable Development Goal 5, which is related to gender equality, strengthens legitimacy and attracts international support. Advocacy aligned with Sustainable Development Goals ensures that reproductive and child health issues are part of broader development and human rights agencies. Building capacity is essential for sustained policy advocacy. Advocates need both technical expertise in RCH and political skills for negotiation. Training in research to policy translation helps turn findings into actionable recommendations. Encouraging youth leadership ensures a new generation of advocates committed to reproductive and child health rights. Add practical steps. Run short, hands on workshops on evidence use, budgeting, and negotiation with role plays based on the real RCH cases. Pair advocates with mentors in government and civil society. And create policy labs where teams practice turning one dataset into a 1 to 2 page brief with 3 to 5 clear asks. Build youth leadership through fellowships, campus clubs, and seats on advisory groups, ensuring young voices shape agendas. Teach media skills, plain language writing, data visualization, and a 60-second pitch so messages are clear and memorable. Finally, track progress with a small skill dashboard and celebrate wins to keep motivations high. To summarize, policy advocacy is a strategic effort to influence systemic change in RCH through laws, budgets, and regulations. Evidence provides credibility, coalitions amplify voices, and timing determines effectiveness. Policy advocacy ultimately strengthens rights and equity, ensuring services reach those who need them the most. In conclusion, policy advocacy is the mechanism through which health rights are translated into enforceable realities. We bring out the data from the grassroots, and through the policy influence, the generated data is transmitted to the higher levels, where are seated the policymakers who make a real change for the delivery of services to the people who are present at the grassroots levels. Policy advocacy elevates reproductive and child health from being aspirational agenda to guaranteed entitlements. By influencing policies, advocates ensure sustainability, accountability, and justice in health systems. As we close, I want you to reflect on this. While medical interventions save individual lives, a good policy saves millions by shaping entire systems. Advocacy ensures such policies exist and are enforced. This highlights the unique power of policy advocacy in transforming reproductive and child health at scale. This lecture today highlighted the role of policy advocacy in shaping systemic change for reproductive and child health. Thank you for your attention. We have explored how policy advocacy works, why is it vital in RCH, and how evidence and coalitions influence systemic change. As future advocates, practitioners, or policymakers, your role will be to ensure the reproductive and child health remains at the center of political agenda and that rights are translated into policies for lasting impact. Next lecture, we will turn our focus to advocacy for vulnerable and marginalized groups, those who often face the greatest barriers but whose voices are least heard. So, we take up the topic of advocacy for vulnerable and marginalized groups in RCH as the next lecture. Thank you.